Dr. Burhan,
Yeah, indeed.
a quick question.
Yes.
When we meet consultants and doctors,
Yeah.
why is it before writing the prescriptions or talking to the patient, they always ask the patient, what's your profession? What has that got to do with giving medical advice?
I mean, it could mean a lot of different things. I think, first of all, I mean, some patients actually, if, for example, right, if a person who is a mason boss who works with asbestos, so he has an increased risk of all these asbestos related injuries. I mean, that could be one reason why people would ask. For example, if he's a driver, especially if they work in the night, if we are prescribing something like Piriton, we would tell them, okay, don't have this drug because this might make you drowsy, and then if he's a driver, it might lead to all of that. So it's very important to ask the profession. But some people ask that because they want to know, I mean, rather than asking what is your monthly income, by asking your profession, we have an idea about how much you can afford. So based on that, I think some doctors do not want to burden the particular person by giving him expensive drugs. Now, for example, again, I'm not trying to condemn anyone or say anything. Now, you go to a dermatologist, right? You pay the dermatologist, I think 3,500 or 4,000, but the medicine that they give you is like around 20-25,000. That's all. I mean, again, so some good dermatologists, very good dermatologists, actually give drugs based on understanding what type of income that particular person has, and based on gives that particular brand. Same way, for example, if you take this simple example, when we are touching on this topic, now you take Comoxiclav, which a lot of people know it as Augmentin, right? So Augmentin is a brand, Comoxiclav is the generic, but we have different brands. Augmentin is very expensive, but there are medicines, there are brands that are not as that expensive, but Augmentin definitely has a higher effectiveness as compared to the other brands, because people recommend Augmentin twice a day, whereas the other brands twice a day, because of the bioavailability, how much is actually going into the blood. So therefore, based on that person's profession, we can judge how much actually they make.